diabetes has gone up 98% in 20 years. Nobody's doing anything about it. CDC's job was to make sure that this didn't happen. And what we're going to do is reorganize CDC.
As someone who's studied chronic disease prevention for most of my adult life, he's relying on you to not understand the causes of lifestyle-related chronic disease in this country, so that he can blame it on the CDC and other public health institutions, but especially the CDC, because he's an anti-vaxxer who's been calling the CDC corrupt for 2 decades and wants to dismantle it. But the thing is that the health issues that we see in this country are not because of the scientists and public health experts at the CDC. They're in spite of them. They're in spite of the daily work of the people in the CDC who stop outbreaks before they spread, that monitor our water and food safety for threats, that fund immunization programs, that support healthier school meals, expand opportunities for our kids to be physically active, and run the National Diabetes Prevention Program. And so many other things to protect people, especially the most vulnerable, from preventable harm. A lot of their work is a big reason why since the 1940s, when the CDC began, life expectancy in this country has increased from 65 years to 79 years. Malaria was eradicated, smallpox was eradicated, measles and polio were considered eliminated, and infant mortality has dropped 80%. It's also true that at the same time we've had so many amazing advancements, the US underperforms in many health metrics, largely in lifestyle-related chronic disease. But that is in spite of the work of scientists and public health experts. That's largely because Americans are not meeting evidence-based health guidelines. Over 90% of Americans aren't meeting fiber and vegetable intake guidelines. 80% of Americans aren't meeting physical activity guidelines. And over half of Americans are eating too much added sugar. We are overworked, stressed, lacking sleep, glued to our phones and social media, and not getting adequate nutrition and physical activity. And the reason for that, or the root cause, is not scientists and public health experts who routinely give out evidence-based health recommendations. It's because we do not support evidence-based health promoting policies in this country. And we have an entire system that prioritizes profits over people's health. From our food system, to our for-profit healthcare system, to our infrastructure that was built for auto industry profits, not walkability, to our long work hours with lack of vacation protection, to our environmental policies that favor chemical industry profits. And layered on top of all of this is income and racial inequality, which magnifies every health challenge. Our health outcomes and these inequities are the logical conclusion of building systems for profitability at the expense of people's health. And the current pro-industry administration is making these problems worse. And they benefit very much from RFK Jr. getting you to believe that the problem is scientists and chronically underfunded public health institutions with people who work day in and day out to save lives, instead of a deregulated pro-industry economy that has consistently prioritized profits at the expense of people's health. And this is the logical conclusion of those policy choices.